video will demonstrate how to perform a comprehensive pelvic examination, which includes an examination of the external genitalia, a Papa-Nicolau test, a bimanual examination, as well as a rectovaginal examination. Women should undergo a pelvic examination when they have vulvar and/or vaginal complaints such as pain, discharge, abnormal bleeding, itching, and/or a mass. A pelvic examination is also indicated when pregnancy is suspected or proven and in women who have been exposed to sexually transmitted infections. Pap testing is the main screening tool for detecting precancerous lesions of the cervix. Before you perform this procedure, elicit the patient's recent history, ask about the date of her last menstrual period, and review her gynecological and obstetrical history, including any history of abnormal pap smears and the type of birth control she is using or has used. For women undergoing routine screening, inquire about issues relevant to the vulva and vagina, such as whether she has itching, abnormal discharge, or dyspareunia. Also ask about total number of sexual partners, patient's sexual orientation, if there is concern about the possibility of a sexually transmitted infection, or has experienced prior discomfort during a pelvic exam. Before examining the patient, wash your hands and put on gloves. Before starting the procedure, you will need to gather the following materials: speculum, gloves, water-soluble lubricant, and materials for the pap test: brush and liquid-based fixative or wooden spatula, cervical brush, and glass slide with fixative. You may also need wet mount materials: pH paper, glass slides, cotton swabs, potassium hydroxide, and saline, as well as materials for testing for sexually transmitted infections. Depending on your clinic setting, testing for gonorrhea and chlamydia may include DNA probes, culture media, and/or PCR. Make sure the patient has emptied her bladder before the exam. Examine the entire vulva, perianal area, vaginal